So what are the age considerations for a hip or a knee replacement? Well, these have changed drastically over the last 20 years. In 1980s, 1990s, we knew that plastic was going to wear out. And if we look at the second-time surgery risk in the 80s and the 90s, you were looking at 7 to 10% per year cumulative risk for a second surgery. So if we look at that, within 10 years, you are getting another one. And that knowledge actually is still out there in the community. That has changed drastically with the advent of the newer plastic. The newer plastic has been out both in hips and in knees for 23, 24 years, which has allowed us to now have really good, solid 20-year data. With that 20-year data, we feel confident that this plastic is probably never going to wear out. If we look at why the hips or the knees have failed, it has shifted from plastic wearing out to other causes. We can talk about those other causes, but all of this relates to now what we're seeing with the age of hip or knee replacement. It has come down drastically because we know these parts are going to last longer. Now, it's also come down drastically because patients are wearing out their joints sooner because of activity or unknown factors or genetics. But certainly as we look at the average age of hip or knee replacement, it's come down drastically because we feel more comfortable putting these parts in younger patients and patients are wearing out their joints sooner. So as I talk to patients now who, initially had a joint replacement 20 years ago, and now they say, what is the average age? We're seeing it come down pretty drastically.